Let's, of course, begin with COVID. Coronavirus infection rates are rising again. They're expected to rise further with schools coming back. 112 deaths a day on average over the last week and close to 1,000 hospitalizations a day. How long will that last, and is it sustainable?
Well, I think you're absolutely right to highlight the rise in the infection rate and, of course, in deaths. What we are planning for is a major booster program. We've had the interim advice from the Joint Committee on Vaccination Immunisation, which suggests that we boost in two phases. If you remember the initial 1 to 9 categories of phase 1, which was the over 80s, the residents of care homes, they've added an additional priority, which is the immunosuppressed, to the booster program, as well as, of course, to their primary cycle, which we are proceeding with. And so we will make sure that we increase the protection and the durability of that protection through the booster. We're waiting on the COV boost clinical study to come through, which will then inform that final advice from the JCVI. But that is crucial that we get that right. And of course, hopefully, transition this virus from pandemic to endemic status, so that future years we'll have an annual vaccination program. Of course, the clinical advice will shape that future vaccination program. But it is important that we continue to protect the most vulnerable, and that's what the JCVI have recommended this past week on the immunosuppressed for their primary cycle, which we're moving ahead with, as well as, of course, protecting the most vulnerable 12 to 15-year-olds that we've been doing through primary care, through their GPs. And they've added to that as well in their latest advice. And then, of course, healthy 12 to 15-year-olds, on balance, they said on the areas which they tried to look at, they came out on balance, it's slightly favourable that they should be vaccinated, but not enough for them to recommend.
Well, you've asked Chris Whitty and the other chief medical officers to review that decision, haven't you, in the round, a further wider review, taking in education opportunities and the like. When do you expect Chris Whitty to report back? Will you report back this week?
So that's what I was referring to. The JCVI, when they looked at this, they said on balance that it is slightly more advantageous to vaccinate than not to vaccinate, but not enough to recommend a universal vaccination program for the healthy 12 to 15-year-olds. Of course, we're vaccinating the ones that are vulnerable, but they also then recommended that because they were only looking at very specifically the areas that they're qualified to look at, they said that there are other aspects, for example, disruption to the education program for children that the chief medical officer would look at. So they're looking at that in the next few days and weeks.
Weeks. So the answer to my question was weeks. We won't hear back from Chris Whitty for some weeks.
Well, it depends. I don't want to preempt, what the chief medical officers of England, Scotland, Wales, and Northern Ireland have to do, which is, convene the clinical advice, public health advice. The JCVI will be sitting in on that, and when they have concluded that work, they will then report back to us, and then we'll be able to make a decision.
Okay.
But no decision.
Understood. Now, the JCVI have somewhat thrown a spanner in the works. We know ministers are keen to vaccinate 12 to 15-year-olds. Many of you have been very open about that, not least the Education Secretary last week. The JCVI have refused to give you carte blanche to do that. They say it's someone else's decision to make. Now, whatever the reasons behind that, they have, without a doubt, cast some doubt in people's minds, some parents' mind, about whether it's the right thing to do to have their 12 to 15-year-olds vaccinated, because, of course, you need parental consent. Can you reassure parents that risk of potential heart inflammation and as a long-term effect, very, very small risk though potentially, can you reassure parents that's nothing to worry about?
Well, I think the really important thing to say on this is that the reason we've had such a successful vaccination program in the UK, 91 million jabs administered, the highest level of positivity in terms of the adult population in the United Kingdom, saying that they will take a vaccine, very likely to take a vaccine, running at sort of 94+%, is because we have been incredibly careful and diligent, whether it be the JCVI with their recommendation of the most vulnerable to be vaccinated first, or the Chief Medical Officer, Chris Whitty, and his colleagues decided to increase the dosing interval from 3 weeks to 12 weeks. And then the JCVI looking at that and saying, actually, optimally, 8 weeks is the right thing as we got into sort of the Delta spike of the variant. I think the parents and the public can see how careful and diligent the clinical advice and the level of research and evidence gathering and sharing that we go into. And I think it's important that we maintain that. And that's how we will, if the advice comes back, that we will move forward on vaccinating healthy 12 to 15-year-olds. I think the confidence in the program will pay off, including, of course, parental consent, if we do move down that path. But no decision has been made until we hear back from the 4 chief medical officers.
I understand. Now, you're already preparing to vaccinate 12 to 15-year-olds. You've taken that decision in advance of a potential decision as the right thing to do to get the NHS ready so you can press the button immediately. Because, of course, children are going back to schools now. That vaccination program is needed now. One point you want to make?
Just on that point, Tom, it's really important to remember that operationally, we've always prepared. So the reason we've been successful is even before the vaccines were approved, we built the infrastructure in the UK. You remember Brigadier Phil Prosser saying at the press conference that we built the equivalent of a national supermarket chain and grew it 20% every week. The reason you do that is because you have to be prepared and ready for all outcomes from the clinical advice.
That's great. You're not getting criticism from this programme, I promise you. I just wanted to ask you the practicalities of how this works, though. Parental consent is going to be needed.
That doesn't mean that we're preempting a decision.
I didn't suggest, Mr. Zahawi, would I suggest for a single moment that you were. Let me just ask you about the practicalities, how this works, because you are doing this preparation. If 12 to 15-year-olds, if parents give their consent, but the teenagers turn up at school or hospital, wherever they're getting their jabs, and they say, well, I'm not going to have it, there's not much you can do, is there?
So the NHS, in terms of the school immunisation programme, is really well practiced and versed in dealing with whether it be the teenager not wanting the jab or the other way around, where the parents don't want their child to receive a jab and the teenager wants to receive.
I was going to ask you about that as well. What do you do? So parents said no, teenager says yes. What do you then do?
Well, the NHS is really well practiced in this because they've been doing school immunisation programmes for a very long time. So what you essentially do is make sure that the clinicians discuss this with the parents, with the teenager, and if they are then deemed to be able to make a decision that is competent, then that decision will go in the favour of what the teenager decides to do.
That's fascinating. So to be clear, the teenager can override the lack of parental consent. If the teenager really wants the jab, they're only 15, the parents say no, the teenager can have it.
If they're deemed to be competent to make that decision with all the information available to them.
That's really interesting. Thank you. Let me just ask you about what we know so far, what you know so far, the absolute front end of all this, about the vaccines degrading over a period of time when they combat the Delta variant. There is some concern, isn't there? Some suggestion the vaccine only has strength for around 6 months or so before it degrades, hence the need for a booster program. Is that your understanding?
So one of the, I mentioned it earlier, one of the fortuitous decisions that we made in the UK, and again, it was Chris Whitty and his fellow chief medical officers who took that really important decision, which is to extend the dosing interval, seems to have delivered a longer lasting protection. So the durability of the vaccines is extended with that longer dosing interval. It's the Israeli example and in the US, where they stuck to the 3-week dosing interval that sees that sort of around 6 month lowering of the protection. Hence why the interim advice from the JCVI is to begin to plan for boosting after 6 months of second jab for those most vulnerable groups in 2 phases. So as I described earlier, so the 1 to 4 immunosuppressant, and then 5 to 9, which is all the over 50s. That's in their interim advice. Of course, we wait for the COVID boost and then their final advice. But the operational planning at the moment is by the middle of this month, we should be in a good place to be able to have the final advice to start boosting those most vulnerable who will need that additional protection.
Okay, another slight clinical question, if you like. What do we know about children getting long COVID? Is there evidence of that? Is there growing evidence that that might well indeed be a problem? Children aged between 12 and 15 especially.
Yeah, I mean, there is some evidence that suggests that there is an impact on children from long COVID. Most people who catch COVID make full and quick recovery, but we know that some continue to suffer. That's why obviously we're backing some additional vital research to help us build that understanding. And so we're looking at we've put about £50 million, I think, into the research to ensure that obviously, one, we get the right treatments to those people, and we've opened about 80 assessment service centres across England, including specialist services for children and young people. And we've backed that with additional funding of about 100 million. So we want to make sure that we're a world leader when it's tackling long COVID. And we'll continue to support those obviously suffering from long COVID effects of the virus.
You might suggest, I suppose, to nervous parents at the moment wondering what to do, whether to give that parental consent, that long COVID, although their children may not suffer from the impacts of COVID itself very much, long COVID certainly is a problem they need to think about.
Well, again, it's one of the things that I'm a parent of, 2 24-year-olds and an 8-year-old, and my 24-year-olds are vaccinated. I would certainly want to make sure that I follow the advice of the UK Chief Medical Officers, because I know throughout this whole vaccination campaign, whether it be phase 1 or now we're entering the sort of the booster campaign and looking at the evidence, we have some of the best advice in the world and the best independent advice in the world. We will be made on that very, very meticulous information gathering that they will do. So when that advice comes through, we will share it, as we've done at every stage, whether it be Jonathan Van Tam and Chris Whitty, or June Rain and Professor Wei Shen Lim from the JCVI. Will share all that with your listeners and with the country. Okay. And I think we'll continue to have very high levels of vaccine confidence in the UK.
Can I ask on vaccine passports, is it still indeed, as the Prime Minister said in June, your intention to bring them in for access to mass events like nightclubs, football matches, even business conferences, and also bring them in by the end of this month, which is also what the Prime Minister said?
So we are, by the end of September, when all 18-year-olds would have had the opportunity to have 2 doses of the vaccine, intending to make sure that in those venues where we know large gatherings, especially indoor, and I pay tribute to the Premier League and the work they've done to get football back and fans into the stadium in such big numbers by checking vaccine status. We are intending to move ahead, as I said in my statement to the House before recess, on using status certification.
You've got to pass law to do that. I mean, presumably you do have to. You've only got 3 weeks of common sitting time before the end of September. Are you going to introduce some legislation this week?
Well, we're looking at how best to do this. By the way, it's worth just saying, no one in this government, certainly not this Prime Minister, it is not in his DNA.
No, we understand that bit. We understand that. But the practicalities, you've got to have to pass a law. You need to get on with it.
But if you need to do something to keep those businesses open, rather than have them, having to shut and open and shut and open, which is hugely detrimental to their future, then this has to be the right thing to do. And we'll look at how we will introduce it.
All right. I mean, you haven't got much longer to look at it.
Well,
thank you, Mr. Zahawi. You haven't got a huge amount of time left to look at it.
I completely understand it. And as I say, we are working very closely with industry. My colleagues Paul Scully, Minister Scully, in Bayes, very much also engaging in this to make sure we get it right.
Let me ask you about social care before we let you go. We're expecting an announcement this week on the government's plans, long expected. Let me ask you this. Is the Conservative Party still a party of low tax?
The Conservative Party is the party of fair taxation and making sure that we get not just the tax rate right, but the tax take right as well, because you will know that it is not just focusing on the rate that makes a difference to what we have in the coffers to pay for, more police officers and more nurses and more doctors and the NHS, which has done a tremendous job in this pandemic. It is the tax take that matters.
Understood.
So we are absolutely committed to that. In terms of social care reform, we're also committed to that. You will forgive me that I will not preempt any announcement or get even tempted to preempt it on your programme. But again, happy to come back and discuss it once we have the details.
You've got a lot to come back to talk to us about, but it was intriguing there that you didn't tell me what has to be the mantra of the Conservative Party since its very existence 100 years ago, that you're no longer the party of low taxation.
Well, as I said to you, we are the party of fair and
fair, not low.
Low.
Interesting.
No, look. Ultimately, what you want to do is make sure that people feel that they're paying fair taxes, and that you get the maximum amount of tax take into the coffers to pay for all the things we want to pay for in terms of this massive, ambitious levelling up agenda that we have. Okay. I'm not moving away from the sort of the value of my party. What I'm saying to you is when we introduce the long-awaited social care reforms, and this Prime Minister is absolutely committed to doing that by engaging both with national and local leaders, by engaging with people who've got lived experience of social care, then we will then come and debate them on your programme, and of course, more importantly, debate them in Parliament.
Okay. Paul.
Nadim, it's Paul Waugh here. Is that timetable that you and the Prime Minister have suggested before for vaccine certificates for nightclubs by the end of September, is that still your timetable?
That is our timetable. That is what we're
And if so, surely you've already written those regulations. Your parliamentary draftsmen have already written those regulations. Can't you just be honest with us and say they're written, they're done, they're ready to go, and you're just trying to manage the party now?
Well, Paul, all the way through this pandemic, I think I've demonstrated that I've come forward and explained every decision that we've made, why we've made it, and why sometimes we've had to change the decision because of evidence of how the virus is behaving. So I will happily, once we are in a position to share how we're going to do this, to come on this programme or any other programme and share the details.
Okay, Mrs. Zahawi, you've very offered yourself repeatedly come back. I think we're going to have to do an entire week of Nadim Zahawi interview programming. So kind is your offer to return.